Profession has changed so much since it started in the 1960s. One of the big changes has been the proportion of males to females. It started a very male-dominated profession, and now it's becoming a more female-dominated profession. So in today's video, we're going to talk about women in healthcare, specifically PAs, and some of the challenges they face, some of the things that women bring to the table, and some of the ways that we can help support each other and lift women up in the profession. We're also going to talk about pay because, that's a big thing. And it's not just pay that affects women. What women are paid affects everybody. So stay tuned to hear more about that and to learn about women in the PA workforce.
Hi, I'm Raquel Akavan. I've been a PA for over 11 years and started my career in surgery. And now I'm currently working as a PA educator, as a director of clinical education at the first PA program in Austin, Texas.
Well, thanks for joining us, Rocky. So you are a pretty active PA. You've done lots of things in the PA profession, but people may not know that you actually have a couple groups that you've started and are a real advocate for. And mostly they revolve around women being in healthcare. First, I know you've done a lot of research into this. What is the percentage of PAs that are female versus male?
We're about 158,000 certified PAs, and about 70% are female.
Yeah, that's quite a number. So one of the interesting things that I've always thought about is that any profession that is either predominantly male or predominantly female, that mixture actually kind of influences the profession. And then within the profession, there are special challenges that each gender has. So what do you think for women are the biggest challenges about being a healthcare provider?
So I think some of the challenges that we are facing as women in the PA profession are gender bias, number one, salary disparities, sexual harassment, and unequal parental leave for all genders.
So let's talk about the gender bias a little bit first. I think for me, the way that it shows up the most is I can't tell you how many times I have been called the nurse or treated like I was an assistant or whatever, or that some male who may be like an MA or patient tech is assumed to be the doctor because they're in scrubs when I'm standing there, even though I'm in a white coat. So that's one way I know that gender bias comes up.
Yeah, so I want to just point out also, even though NPs and PAs are predominantly women, I think that it's important to point out that a lot of our superiors are usually men. And although our professions are mostly women, right? Our collaborating physicians and people that are supervising us are predominantly men. So there is a lot of bias that does happen at work, in the workplace, that we are dealing with. And so I just want to point that out first. It's really important that people understand that. So basically, there's these societal norms that control the way women are perceived. So that is the first issue that causes gender bias. For example, women, if they're assertive, they can be called pushy or loud or all of these things. And that's a bias. Those are all traits that are usually given to men, but are looked down upon when women have them. And that's just not fair, number one. The other thing is, when we analyze the performance of women at performance reviews, a lot of times they're reviewed with different types of adjectives. Usually women are described in a feministic tone, like team focused, nurturing, and communal. In contrast, men are usually described as a leader or innovative. And I think that this type of bias should not be done. We shouldn't give people descriptive words based on genders, and it should be more equal and be equitable as well.
These are biases that people don't even realize that they're having. And people may say, oh, they're just words. What's the big deal? But it really does matter in the end. If you're not seen as a leader, but seen more as, like you said, pushy or, just mean, that really can affect your advancement and if people feel like you can move up to the next level. So it's really a much narrower line that women have to walk between being assertive and being powerful, which are good things, and being perceived as somebody who's not easy to work with or, pushy and rude.
So in contrast, when men act this way or are perceived this way, they're actually getting really great performance reviews. But when women are acting this way, it's usually looked down upon. And so that's really something that's not equitable or fair. So that's something that everyone should be aware of when doing their performance reviews.
There are certain, aspects of the profession that for not only PAs and NPs, but MDs, I'm sure surgeons, female surgeons face this. There's just certain areas that we think those men do those jobs. Even though this seems so strange to say in 2023, but I do it. I grew up thinking men are doctors, and especially surgeons, orthopedic surgeons, people like that. We automatically assume that it's a man. So some of those things just take time to work out, I think. But I think the important thing is for us to be aware that those biases are there, and to think about what biases we have ourselves.
Yeah, and as a
Um,
surgical PA, this actually happened to me. I was actually given a performance improvement plan because a couple of male surgeons refused to work with me because I was a female. And I'm also short and pretty petite. And they literally said, point blank, like, we don't want to work with females. She isn't strong enough. And this is not true. Like, I was definitely strong enough. I was definitely really great at my job. And I just didn't think it was appropriate for surgeons to refuse to work with me just based on my gender. And it actually happened to me.
Yeah, and that affects your career. I mean, it's not just, these aren't just, hurt feelings we're talking about here. We're talking about people's actual career, and we worked just as hard, in some cases harder than men, to get to where we're at. That's why this topic is so important.
The other thing I want to point out is the only reason they were able to refuse to work with me is because they were my superiors at work. These men that thought it was okay to do this, to say that they wouldn't work with a female. Also, not only like just gender bias, but societal norms plays a role too. Women have more responsibilities at home usually than their male counterparts, and their careers may be viewed as less important than like their spouses. So this can cause women to feel pressure to leave their jobs early, take or longer leaves and absences. And so these societal norms that we've created as a society really do affect women. The other thing we should talk about is maternity leave or parental leave, which is more an inclusive term. So for women who decide to have children, obviously a lot of them are going to decide that reducing work hours are necessary during that time. And when women leave their careers, it does set them back no matter what. Like, they don't get as good performance reviews because they've been gone for 6 months or whatever it is. But it should be equitable. It shouldn't always be the mom having to take a full year off or a full 6 months. If they want to come back, then their spouse or whoever, their significant other, could also take a little bit of time too. To be fair, I think most institutions should offer paid family leave. If everyone got paid family leave, it would help women not have these disparities and help them move up and have leadership positions.
And I have to say, as being a woman who has never given birth, and not having to go through that process of taking time off from work, I've probably looked at it more from the other side, like the business side. And in fact, I've been guilty of thinking about, like, wow, that's a lot to ask a business to not have an employee there for 3 or 6 months, and who's going to do all that work where they're gone, and then just have that spot open. But I like that point that you made about if parental leave in general was more normal in our society, then it wouldn't single women out as much and make it seem like such a glaring hole. It would be something that we're used to accommodating and working around even more. And of course, if men did it and it's okay, then then it would be much better for women in the long run.
Right. And
So
so basically, if you make parental leave more inclusive, because we have so many different types of families out there, so we shouldn't call it maternity leave. We should call it parental leave to be inclusive of all different types of families. When you make it inclusive, it does help balance it out for these families and gives time for both spouses to take off this care for their families.
then there's also the issue that's been around forever as well, which is sexual harassment in the workplace. I definitely think that has improved as time goes by, but it is not completely gone. And there are many people that are facing tough situations, especially when you move up into professions like we have. It's not easy just to leave and get another job or to blow the whistle on somebody that's your supervising physician, maybe.
Obviously, harassment is an issue in all professions, right? But from my research, I found that actually in the medical and healthcare professions, it's much worse, and women are more susceptible to sexual harassment and bullying. It could be something as simple as like people flirting with you at work that makes you feel uncomfortable. It could be, something more egregious, like inappropriate touching and stuff like that. That these people that are doing it, they think it's totally innocent, but it's absolutely not. It makes people feel uncomfortable. And usually it is a superior doing that. And if you think about it, it's really hard for women to move up into leadership positions if they feel harassed because it's decreasing their confidence. They may feel that they can't report these because of retaliation and other issues.
Yeah, which goes back to most of our supervising physicians and people in power above us are at this point still men. So another reason to encourage women to seek positions in administration. It's exciting also to see more females becoming physicians, and hopefully they will continue to rise up in the ranks as well, and we'll have a more balanced workforce. And then the other thing, probably the biggest thing that most people think about or are aware about when we talk about women in the workforce is just the difference in our salaries. There are places that I've seen that are being more transparent and they actually post what the salaries are. But traditionally, it's always been, don't talk about your salary with your coworkers. And that really doesn't help us, right? Because sometimes you don't know what your coworkers make, and then when you find out that men are making more than you for the same job, that's just, I don't want to say frustrating, because infuriating, I guess, is a better word for it.
Even though women make up more than 2/3 of the PA profession, as women, we're making about $13,380 less in compensation. And this is according to the 2019 salary report from the American Academy of Physician Associates. What I'm trying to basically advocate for is that we all work together, men and women in the PA profession, to help women get better salaries. Because if women have better salaries in the PA profession, that means everyone's going to have better salaries in the PA profession because we are the majority.
Yeah, that's an excellent point, and something I think a lot of people don't think about is that it's not just a women's issue when it comes to pay. Like you said, it affects every PA out there, because you have a large percentage of women out there making $14,000 less per year than other people are going to base their salary, what they're offering, on those figures. So men out there, if you have the opportunity, don't just help us out, help yourself out by advocating for us. So we've identified, some of the problems and the special challenges that women face in the workforce today. So what are some ways that women can feel supported themselves in the medical profession, and ways that we can uplift other women?
So I think it's really important for women to celebrate each other's accomplishments and really support one another. Mentorship is really important. So we should all feel that we have to mentor each other, whether you're a very experienced PA or you're a new PA. Mentorship is key. Also, institutions should be supportive of women advancement, having their support, having inclusive paid parental leave is really important. Open awareness and communications and transparency for salary would be great.
And so what about any kind of specific organizations that you think that women would be interested in joining if they're looking for some place to go for some solidarity and to be involved in helping women advance in medicine?
Yeah, so me and a few other women started PAs for Women Empowerment, and we're actually a caucus. So we do have a voice at the House of Delegates, which is amazing. We have a mentorship program, and we are basically trying to create the next generation of leaders in the PA profession and trying to empower women to do this, to become leaders and to mentor each other. So you should definitely join PAs for Women Empowerment if you're interested in helping this issue and decreasing the gap for women. You can join by going to www.pasforwe.org. And we have a Facebook group, we have the mentorship program, we have free CMEs on our website for members. and a lot of other benefits as well.
Great. Well, I'll put that link down below in the description box. The more women that get involved and lift each other up, hopefully we'll get to the point of equality in medicine. We talked a lot about the challenges and some of the depressing stuff, but what do you think that women bring to medicine that should really be celebrated or talked about? Or what do you think are the special gifts that we bring to medicine?
So there's actually research that was done in this, and a lot of patients have better satisfaction from women providers versus men because they do provide emotional support or empathy, like a very good sense of empathy as well. We are wonderful providers. We're really smart, and that should be celebrated. There's also research that states that diversity in the medical profession does increase patient outcomes as well.
And I just want to say there are many fantastic male providers, be they physicians, PAs, or NPs, that help us and support us as well. So I just want to say thank you to all of you who may be watching. And hopefully we get to a point where we don't have to have these conversations and we can just support each other just as people in the workforce. Well, thank you so much, Rocky, for joining us today. Thank you for the work that you do in helping women in medicine and to feel supported and to feel like they have a place at the table.
Yeah, you're welcome. It was so great being here. Thank you for having me. It was really an honor to be at the medicine couch.
Well, thank you. I'm very thankful for the women who in the past fought to become a PA and who paved the way for us. While things have definitely improved for women in the workforce, there is still further work that needs to be done. Now I hope that we continue their work and that we can bring equity and equality into the workforce for all people. I also recorded another interview with Rocky about PA moms, what it's like to work in medicine as a mom, the special challenges faced, and the wonderful support group that she created. So if you're interested in that interview, it'll be linked here. Thanks for joining me today. Take care, stay sane, and I'll see you next time on the Medicine Couch. Bye.